Akhil and Dr. Nishi to felicitate our second pillar of sexual medicine practitioners group, that is Dr. Mrs. Ajayan. Ma'am has been a strong support to all of us. Whenever in the conference we need anything, we go to ma'am. So I welcome Dr. Navneet. I welcome ma'am. Ma'am, kindly join us on the stage for the felicitation. Thank you, Dr. Navneet. Thank you very much for the wonderful talk. Ma'am, kindly join us on the stage. Sir, please join us on the stage. A huge round of applause, please, for ma'am also.
किसको मैं बोलने जा रही हूँ इसका हाँ पता नहीं So I think we should invite our next speaker, Mansak Shishak. Dr. Mansak Shishak is a MD DNB in dermatology. She is a consultant dermatologist, ISIC, multi-speciality hospital, and Dr. Mansak Skin Clinic, New Delhi. She owns multiple publication presentations. She's the editor in Pigment International, principal dermatologist and volunteer at SCI, Scleroderma Foundation of India, and Derm Sarcoma Society. Current convener, IADVL Medico-Legal Committee, a special interest in immunology, drug therapeutics, and biologics. Very impressive your CV is. And she is going to speak upon vaginal rejuvenation procedures, safety and efficacy. So Dr. Mansak, yours is the dais.
Thank you so much, ma'am. Good afternoon, everyone.
I'll interrupt you, Dr.
Yes,
Mansak,
sir.
for 1 second. If anybody is left for the lunch, we are about to close the lunch. अगर कोई भी lunch के लिए रह गया तो please lunch कर लें, because we are closing it. Thank you. Please continue.
I want some sweets. So today, my topic is on vaginal rejuvenation procedures, safety and efficacy. This will be a broad overview of what exactly is vaginal rejuvenation, what it means, and how should our approach be towards it. So this is a brief overview of my talk. I'm going to define it, see why we're doing it, few different methods of doing it, and also look at the safety and perspectives of it. What is vaginal rejuvenation? First question. So rejuvenation as such, the word itself means to restore, to renew, to refresh. So to make something youthful again, something which has been old. So, to give back that vigor, which I'm sure we have all been discussing since morning. So in a broad way, these are any procedures that enhance vaginal aesthetics, which is the cosmetic appearance, as well as sexuality and functionality as well. This is not a new concept. If we think that it's modernization which has led us to pursue such things, it's not. It's actually a very old concept. It goes back as far as 1,000 years ago, in 1050, in fact. There's an Italian lady, Trotula, who first described it in one of the 3 volumes, Treatments for Women, of which one volume focused exclusively on cosmetic treatments and the genital aesthetics. So we have to remember that this is not exactly a medical terminology. It's more of a marketing term which has been introduced. And also it's an umbrella term, so it's quite a vague term. It refers to a spectrum. And it is used to describe a range of aesthetic and functional procedures, anything that corrects and restores the optimal structure of the vagina, as well as the surrounding structures. The question is, why are we trying to alter or restore the genital anatomy? Why are we trying to tamper with it? Now, there are many reasons why we do this, or why we're trying to pursue it. Of course, women after childbirth, as a result of aging, influenced by genetics, or even a past history of trauma, all of these things will lead to genital looseness or a feeling of laxity in the genital areas. This is not specific to genital areas alone. Of course, our whole body ages, as ma'am said, we use PRP from head to toe, so we are aging from head to toe. In fact, from top, from inside out and outside in also, meaning from the skin down to the periosteum, every layer is aging. So it's the musculature, the fat, the ligaments, the fascia, and the bone. Everything is undergoing resorption and aging. And it's influenced by genetics, by gravity, by a lot of other factors. So that is why there are profound changes as we age. So, and some, of course, to gain greater self-esteem, also try to restore or change the genital anatomy. Some patients, of course, they have diminished functional discomforts and difficulties because of which procedures are sought. It's also used to improve sexual pleasure. So these are some of the clinical problems for which people may seek procedures. Some of them are stress urinary incontinence, atrophic vaginitis, especially after menopause, decreased sensation during coitus, generalized dissatisfaction. This is the commonest complaint for which dermatologists approach. That is and that is they just don't like the appearance of the external genitalia. They don't like the color, the size, the shape. And so they would like to restore it. So as you can see, there are both cosmetic as well as medical reasons for which people seek to revitalize and strengthen the elasticity of the vaginal wall and also hydration of the mucosa. Broadly, there are different methods of addressing this issue. So you could say that there's invasive methods and non-invasive methods. Now the invasive methods as such are surgical procedures, which I will not be really going into details today because this is under the purview of gynecologists and plastic surgeons. So they include reconstructive surgeries like labiaplasties, so any reconstructive procedures of the genitalia. So labiaplasty could be labia majoroplasty, minoroplasty. It could also be reconstruction of the vagina, vaginoplasty, hymenoplasty. These are some of the few procedures. We will be looking at the non-invasive methods, starting from topicals, hormone replacement treatment exercises like Kegel's exercises, which works to strengthen the pelvic floor muscles. We also work with filler injections. These are injectables, hyaluronic acid-based fillers. Plus, there are devices. So devices are either energy-based devices, including radio frequency lasers like Q-switch, Nd:YAG, CO2 laser, fractional CO2 laser, as well as regenerative medicine, which Dr. Navneet has been speaking about on PRP. Aside from this, there are chemical peels as well. So broadly, these are the methods, which address genital dysfunction, rejuvenation. There was a Guardian news article in 2011, which kind of slammed the whole industry, the cosmetic industry, for working on such procedures, and why there was such a big demand for cosmetic procedures. In the last 2 weeks, Barbie movie has been the talk of the town, but the Barbie doll look, as far as the genital aesthetics, has been there for quite some time, and this is the look that has been promoted to plastic surgeons, and marketing agencies have been doing this. The Barbie doll look of the genitals is basically a pre-pubertal look of the genitals. So it refers to non-hairy genitalia. It refers to a smooth contour, free of any pigmentations, no laxity, no looseness, and no folds. And also a look where the labia minora is not really seen externally, which is covered by the majora. Now, this is the sad reality that such a look has been propagated, even after knowing that everyone has different anatomical variations, and it's actually quite normal to have different kinds of genitalia. But this look has been promoted by popular culture, and also thanks to social media and internet, also affected by internet porn as well. Aside from this, dermatologists are responsible for popularizing laser hair reduction of the genitals also, which just increases, the look and the want of such a look. Like I mentioned, a standard representation of female genitalia in magazines has caused people to seek such an appearance. Okay, back to surgical interventions. I won't go much into this, but basically in surgical interventions, what they do is, the aim is to reduce the diameter of vaginal canal, excise the redundant vaginal tissues. It also aims to tighten the musculature, working on certain muscles. It's similar to, of course, our esteemed gynecological seniors will explain this, similar to anterior-posterior colporrhaphy, may be associated with perineoplasty also. So the whole aim is to reconstruct the vaginal introitus and reconstruct perineal body. There are studies which have shown that women who have undergone vaginoplasty, perineoplasty, have reported higher rate of satisfaction in terms of enhancement of sexual functioning. Are these procedures actually recommended? In 2007, the American College of Obstetricians and Gynecologists, they pointed out, they published a critical position paper on female genital cosmetic surgeries, saying that they are not acceptable surgical practices because there is a lack of data supporting efficacy and safety. On similar lines, in 2013, there was an ethical opinion paper which the Royal College again underlined, saying that promoting such a thing as unproblematic lifestyle choice is inappropriate, meaning when such procedures are usually, it's usually left, the choice of undergoing such a procedure is left onto the patient. Doctors usually say, if it's up to you, you want to go for it, but is it really the right approach? They said it's no, ethically, because it misinforms women about the actual efficacy of these procedures. Similarly, the New Zealand and Canadian Society also took a public stand against such cosmetic procedures. But having said that, let's have a look at what are the different methods, non-invasive methods, starting with topicals and peels, which we most commonly do. Now, topicals and peels, topicals are actually quite often requested because patients usually come, any frictional area of the body will have dyspigmentation or pigmentary changes, and the genital area is one that is not free of it, so we usually get a very common complaint in the OPD, complaining of hyperpigmentation or darkening of the skin around the genitals. So, as far as the darkening of the skin around genitals is concerned, first of all, it must be handled by a dermatologist because there are many, many causes of pigmentation and dyspigmentation around the genitals. And so a thorough evaluation must be done by a dermatologist. The reason being, lightening agents must be used very cautiously, and they should be used only after evaluation and strict monitoring under a licensed dermatologist. Also, in the market, there are lots of triple combination creams containing steroids, retinoids, and hydroquinone, which is a bleaching agent. And all of these are known to have adverse effects, especially when used without supervision. So we have to be extremely careful as far as topicals are concerned and not apply and not prescribe the standard steroid creams which people usually prescribe. Chemical peels are done sometimes. In certain cases, we can use superficial chemical peels, in some cases medium depth peels, but no deep peels should be done. Again, this should be done only under the supervision of a dermatologist. The American Academy of Dermatology came out against the use of topical bleaching creams because, like I said, it has high concentrations of hydroquinone. And these are bleaching agents. It has adverse effects, long-term adverse effects, one of which is actually even more dyspigmentation and purplish discoloration around different tissues known as exogenous ochronosis. There are also reports of dangerous ingredients like arsenic, mercury, which are there in these agents, so we have to be very careful. The US FDA has not approved any cosmetic treatments for vaginal rejuvenation, including vaginal bleaching. In fact, it can even cause burns, scarring, long-lasting pain. And these are not uncommon side effects. These are actually common side effects which we see in the OPD on a more regular basis than we would want. Next, I'd like to show how injectables like fillers are done for vaginal rejuvenation. So this was a paper by Doris Hexel, in 2016, they have shown how fillers can be used to augment the area around the genitals. So over here, you can see that there's slight hypertrophy of the mons, along with the labia majora and the minora. In such cases, use of a filler, which is hyaluronic acid filler, can help augment the tissues a little bit in giving some cosmetic relief. And it's also non-invasive, it's relatively safe. How it is done is first mark the area to be injected, then use a cannula and the insertion point can be somewhere around the mons so that we can give the filler product in the mons as well as the labia majora. And so this filler product is then injected wherever you want to using they have used 7 centimeter long cannula. So you can see the tip is reaching up to here where the fingertip is. So that's how you can go about it. You can go in an inward-outward thread work deposition, and don't inject more than 3 ml per side, as per the recommendations. Again, the filler that was used here was recommended, was approved by the Brazilian agency, but otherwise not approved by US FDA. But yes, in clinical practice, we can give hyaluronic acid fillers. They're relatively safe. Some of the adverse effect is there may be temporary pain, little bit of bruising, but otherwise it's a safe procedure and patients are relatively happy with it. Always remember, we need to know the anatomy very carefully. We need to select the filler, what kind of filler to use. The depth of the placement is important, and use of the proper cannula in order to get safe and good results. PRP, I think a lot of talk has been given on this. I will not go too much into details. It is a form of regenerative medicine. It's quite safe in clinical practice, whether we use it to regenerate the skin, superficial tissues. It does work well. It is almost free of adverse effects in terms of granuloma. We hardly see granulomas or scarring, provided we maintain asepsis during the procedure. How it acts is it activates the pluripotent stem cells wherever in the area of injection, and so it helps rejuvenate and enhance the damaged tissue. One of the advantages is that if you compare it with fillers or some of the older fillers, they had compounds such as calcium hydroxyapatite. Now, these were extremely thick and viscous and in fact used to cause a lot of lumpiness and bumpiness, and besides other side effects. However, PRP is actually very free-flowing. It's safe, it's from the body, from the patient's own body, and it's also it's not antigenic, so there's no inflammatory response. It's quite a safe thing. Because of the aqueous nature of PRP, we can easily inject it with a, say an insulin syringe, small bore needle, and we get an even distribution, and also the area around it gets rejuvenated nicely.